September is Sepsis Awareness Month, and experts say recognizing the signs early can be the difference between life and death. Today I spoke with Eisenhower Health's Sepsis Program Coordinator, Denise Lewis, who shares what everyone needs to know. September is Sepsis Awareness Month, and today we're joined by Denise Lewis, who is the Sepsis Program Coordinator at Eisenhower Health. Denise, thanks so much for being here.
Thanks for having me.
First off, can you explain why sepsis awareness is so important? And for people who aren't familiar with the severity of sepsis, why is it so bad?
So sepsis is really, it starts with an infection, and then your body's immune system kind of goes out of control, and in fighting that infection you end up damaging your own organs and tissues, and it can progress all the way up to shock and death. And that can happen very quickly, and so we really want to make sure that people are aware in the community that it's so important to get treated as soon as they have an infection.
How common are sepsis infections, and how dangerous can they be?
Well, they can be anywhere from, just a minor infection that progresses, but all the way up to, all the way up to shock and death. At any given point, we have anywhere about, I'd say 15% of our patients can.
15%? That's a lot.
There's a lot. Sepsis is the #1 healthcare problem.
What do hospitals then need to do to prevent this?
So really a huge part of it is community education. That's part of why I'm so glad that you guys would have me here, because most of our patients arrive already in a state of sepsis. So knowing when to get help, immediately to prevent it from happening in the first place. Prevention, a good prevention is really the best way. Getting hand hygiene, vaccines, not getting sick in the first place, of course. Once we have patients that are arriving to us, we're screening them to see if they're starting to go from that just simple infection into a sepsis state.
And I know Eisenhower is taking specific steps to help prevent sepsis.
Right. So every patient that comes into our emergency department, we're screening them to see if they are having alterations in their vital signs, if they're having signs of being impaired organ tissue perfusion, mental status changes, and we have 3- and 6-hour bundles that we follow that are recommended by the Surviving Sepsis campaign.
What are some of the warning signs? If people are at home and they have some type of an infection, what do they need to look out for to make sure it's not sepsis?
Yeah, so that's a really great question. So we follow an acronym that is recommended by the Sepsis Alliance, and it's TIME. Time is of the essence whenever you have an infection. So we're looking for changes in temperature, not just a high temperature, but also a low temperature. Infection, obviously. M for mental status changes, and E for just feeling extremely bad, right? Worse than you normally would. Okay, that's a big thing that we hear from patients is like, I've been sick for a few days. I've just never felt this bad before. It can be very nebulous. So yeah, it's really important that people come in, especially if you are older, if you have multiple medical concerns, are on multiple medications, are immunosuppressed. Those are risk factors that put you at a higher likelihood of developing into a sepsis state.
Well, certainly an important topic. Denise, we appreciate you for coming in today. Thanks so much for joining us.
Thanks so much for having me.